Good afternoon, ma. I'm contacting them to join the class. I'm just dropping a message for the group.
I just can you hear me?
Yes, ma. I can hear you, ma. Good afternoon, ma.
Okay, I'm the one that cannot hear you. Mr. Joseph, speak. Let me see if I can hear you now.
Good afternoon, ma.
All right, good afternoon. Thank you.
Welcome back.
You wait for your people. In fact, we don't have time more.
I just dropped message on the group for them.
All right. And before they come, let me just, okay, don't worry, when they come.
Okay, ma.
If one other person joins you, then we'll kickstart the class. But if I wait in the next 5 minutes and nobody joins you, you are going to be my only student.
Okay, ma.
They are coming now. Welcome back, everybody.
Thank you, ma.
Okay, we have two persons now that have joined you, so I believe we can continue the class.
Yes, ma.
Okay, so Okay, I'm trying to take this away, but if you can see my slides, we're going to be looking at budgeting and personnel management in Nigerian social welfare. Budgeting and personnel management. Initially, we said we're going to be looking at key concepts in social welfare. The four basic concepts that we said we're going to look at were control, coordination, budgeting, and personnel management. In the earlier part of today, we looked at the control and coordination. Now we're going to be looking at budgeting and personnel management, and we're going to kickstart with budgeting. Budgeting as a tool for social welfare. What is budgeting? Budgeting is a central concept in social welfare planning as it determines how resources are allocated, prioritized, and monitored. This is to say that budgeting has to do with resource allocation and how resources are being prioritized and also how they are monitored. It is not safe for you to just allocate resources and then you don't monitor to know actually if these resources were put to proper use, or it's not good for you to just allocate resources without having a valid reason why you are allocating these reasons, or a certain area needs core intervention. You close a blind eye to that and you now decide to allocate resources to another area that does not require immediate, or that's not an emergency and does not require immediate intervention. So budgeting has to do with how you allocate resources, how you prioritize them, and how you also monitor them. So we're going to be looking at some scenarios in Nigeria. In Nigeria, budgeting affects who receives social support, how much social support they receive, and how consistently they receive this support, especially in the context of a limited fiscal space. That's especially in the situation where you know now Nigeria they're always crying out there is no money, no money. In fact, they say we are living on deficit on borrowed funds. We are currently living on a lot of borrowed funds that even if they sell all of us in Nigeria, they will not be able to repay back the loan. So you see that despite this limited fiscal space that we have and high poverty rates, budgeting is very, very essential so that you don't just throw money, the little money available, so that we don't just throw it away without actually achieving any tangible results. Okay, we're going to be looking at certain concepts under budgeting. And the first concept we're looking at is budget allocation. Budget allocation is the amount of money assigned to social welfare sectors or programs in the national and subnational budgets. Budget allocation has to do with the amount of money set aside for a particular sector. For instance, in Nigeria now, the government, federal government always sets certain amount for, to different sectors. Like the educational sector receives its own allocation, the health sector receives its own allocation, the transport sector. So different sectors receive their own allocation. So that is what budget allocation is. The amount of money assigned to social welfare sectors or programs in, let's just put it in Nigeria. So now social welfare programs in Nigeria are often underfunded. This is a very big challenge because um, priority is really not given to the social welfare of the country. Maybe it might be on paper, maybe policies are developed to actually impact on the social welfare of citizens of Nigeria, but the implementation process is usually very poor. And most times, government does not give adequate funding to the social area of the country. And this is a very big challenge. Here we can see that in 2023, the federal government the Ministry of Humanitarian Affairs received, that's in 2023 federal budget, the Ministry of Humanitarian Affairs received less than 2% of total spending. You can imagine, out of all the sectors in Nigeria, and based on the percentage, the only percentage that could come to social welfare was 2% of the entire total spending. This is very, very poor. If you really cater for the social welfare of your people, assigning only 2% to them is really, really not good enough. The next key concept under budgeting is budget prioritization. We said budget allocation is the amount of money released to different sectors, especially the social welfare sector, since we are narrowing it down to social welfare. So now we're going to be looking at budget prioritization. This is a process of deciding which sectors, programs, or populations receive the highest funding priority. In Nigeria, priority is often given to capital projects over social investment, especially during election cycles. So now, for what we are seeing now is that Nigeria as a whole, they don't like to give priority to the social sector. They rather prefer to invest in other things and turn blind eyes to the social sector. That means if on the list of priorities, social welfare is not even close to being at the top, and this is not good because um, when social welfare is involved, that is when the marginalized groups benefit. That is when the vulnerable benefit. So if you do not give um, pay close attention to the social welfare of the nation, that means these marginalized groups will be in the dark. They will be the ones at the receiving end. They will be the ones suffering the impact of lack of proper budget prioritization. The next key concept is budget implementation. Budget implementation is the actual release and use of budget funds for social programs. Budget implementation is the actual release and use of budget funds for social programs. So once there is the budget is drawn, that's once budget allocation is done based on priority, budget implementation is the next. And this has to do with the actual release of this fund, not just the release, but also the use of the budgeted funds for social programs, making sure that these funds are actually used for what they are intended for. Most times, only a fraction of the allocated funds for social welfare is actually released due to cash flow issues or bureaucratic delays. This is to show that sometimes, even though the
We
budget
can't
states,
see the slide.
even though the budget states
Sorry, we
that
can't see the slide, ma.
really,
The slide
Yes,
is
ma.
up. Yeah, I can see it.
wow, but it's there.
It's network issue. The slide is off.
Okay, sorry about that for the person that can't see the slide. Since some other persons are seeing it, I believe I can go ahead. Should I go ahead?
Yes, ma'am.
Okay. We're saying that most times when budgets are released, you at the end of the day, those that are actually responsible for giving out these funds, we not give the actual amount that has been approved. They won't actually give the amount that is approved, and this affects the implementation process. Or most times there are bureaucratic delays because of too many protocols, too many processes, too many procedures. You will see that maybe um, when the fund comes, it might be too late. So at the end of the day, budget implementation has flopped. So some state governments fail to release funds for their own social protection plans, even when approved. That's just what we talked about. Sometimes when the approval comes, they don't still release the funds. Like in our institution here, in my department, there are so many times we apply for office equipment like printers, photocopiers, and all of that. The VC approves, um, BOSA approves, and then when you now go to the store will tell you they are not available. Even after approval has come, you will keep going and going and going until you're tired of going. So all this affects budget implementation. Despite the fact that approval comes, sometimes the money is not really released. And even if it is released, maybe a part of it, only a part of it will be released. So that is budget implementation. The next um, concept we're going to be looking at under budgeting is transparency and accountability. Transparency ensures that budget processes are open, monitored, and accountable to the public. With transparency, it means that budget processes, that the budget allocation uh, and budget prioritization and everything surrounding budget should not be done in secrecy. The major stakeholders should be carried along so that they know who should be held accountable. Because if they don't know who to be held accountable or who is saddled with certain responsibilities, they will not be able to follow up to know that this person or this organization is supposed to do this, is supposed to do this. Money has been released for this, but they have not yet done it. So it is always good that there should be transparency and accountability in a budgeting cycle so that trust is built. In Nigeria, budget documents are not always accessible or detailed. Most times they hold information. They don't want people to know, they don't want the public to know that this is actually the amount that comes to this sector or this sector or this sector. So with that, there is every tendency that there will be corruption because since you don't know the amount that is actually released to the health sector or to the educational sector or to the banking sector or to that we don't know the amount released to the or agricultural sector to all of these sectors, it will be difficult for you to monitor for cases of corruption. And this also leads to low people will not trust you anymore. The communities will not trust you anymore because you are not doing things in a transparent manner. You are not carrying people along. So they don't even know what is done and what is not done. So it's always good to be transparent in any budgeting procedure or process. Then it also, when you're not transparent, when a budgeting cycle or a budgeting process is not transparent, it leads to poor evaluation because those in charge of carrying out this evaluation, at the end of the day, because money is not released, they are not motivated to go for this evaluation. Even when they decide to go, they go and do this casually. They don't give their best because of lack of motivation. So transparency and accountability is very key in a budgeting process. The next is participatory budgeting. Participatory budgeting has to do with involving citizens, especially marginalized groups, in the budget decision-making process. When major stakeholders are carried along, the people are happy because they believe that their representatives are there and will speak for them. But when there is no participatory budgeting process, the government just sits on their own, take decisions on their own without inclusion, you see that the budgeting process will fail. That's at the end of the end result or the welfare scheme or the welfare package that is meant for the people will not be effectively delivered because there was no participatory budgeting. Most times in Nigeria, women's group, disability associations, and youth organizations often have no voice in how welfare budgets are designed, and this brings about mismatched priorities and inequitable access. You know, women are often seen as the weaker vessels, so they don't love to always involve them in certain decision making process, and it's not good. So and then also people living with disability, most times they are not carried along too because they suffer discrimination, they suffer sidelining a lot, and it's from this our talk today. We are encouraging that every budgeting process should carry everyone along, the women's group, the disability associations, the youth organizations. Like I remember when we were small, they keep singing, "We are the leaders of tomorrow." These are the youths, children singing that they are the leaders of tomorrow. But unfortunately, tomorrow keeps coming, and we're not seeing youths being leaders. They always want to pick, well, maybe in Nigeria we believe that, some people believe that with age comes wisdom. That's wisdom comes with age. As one advances in age, they tend to be wiser, they tend to lead better. So maybe that's the system Nigeria is adopting because I don't understand why we will have young people vying for certain positions, and at the end of the day, um, our four leaders, our ancestors are still the ones ruling. So it's always good to involve everybody in participatory budgeting, even the youth should be carried along. The next is, okay, in conclusion, in Nigeria, strengthening budgeting practices through increased allocations, transparent implementation, and community participation can significantly improve the reach, effectiveness, and equity of social protection. I take it again. In Nigeria, strengthening budget practices through increased allocations, transparent implementation, and community participation can significantly improve the reach, effectiveness, and equity of social protection systems. So if we want the social um, well-being of citizens to be effectively done, or if you want social welfare packages to be delivered successfully, it is good to strengthen budget practices. How? By increasing allocations. The amount that is released for social welfare should be increased. Then there should be transparent implementation. As this released or approved amounts are being disbursed, it should be done in a transparent manner so that everybody knows how much was approved and how much has been used or expended. The next is community participation. To strengthen or to improve the reach and effectiveness of social welfare, it is good to improve community or increase community participation. It's good for everybody to be carried along. The social class always talks about inclusion. They want everybody to be carried along. They don't want anybody to feel disadvantaged. They don't want anybody to feel relegated to the background. So they always advocate for inclusion. So budgeting practices also should focus on community participation. for effective social welfare delivery. Having said that, we'll just look at challenges in budgeting very quickly. Excuse me, please. I hope you can still see my slides.
Yes, ma.
Yes, yes, ma'am.
Oh. Okay, so we're going to be looking at challenges in budgeting. And the first of on the list is insufficient budgetary allocation. Insufficient budgetary allocation. That's what we're talking about. When enough capital or enough funds is not released to the social sector, it's a challenge. At the end of the day, social welfare will not um, will not be successful. Social welfare consistently receives low prioritization in national and state budgets. And this is not good because it has implementation, and the implementations are one, limited coverage of vulnerable populations. Maybe you were supposed to cover 1,000 persons, and because the funds released were not enough, at the end of the day, maybe you just be covering 200 people, or maybe there's a number of communities we're supposed to cover with your welfare package, maybe 10 communities, but because there is insufficient allocation of these funds, you're only able to cover like three, four, five, or six. You see that's a big challenge. So an implication for insufficient budgetary allocation is limited coverage of vulnerable populations. Another implication is you are at the end of the day, there will be inadequate funding for social safety nets. That's there will be no enough funding for shelters, for mental health support, for career development, or for that. You see that so many things will be lacking behind because there is not enough funds released. So we have come to the second challenges of budgeting, which is poor budget implementation and release of funds. Poor budget allocations and release of funds. The implication for poor budget implementation is that programs will delay. When these funds are not released on time, the programs delay, and sometimes it might even come late. The funds might come late, and at the end of the day, the social welfare of the people was not taken into consideration. So, one of the implications for poor budget implementation and late release of funds is program delays or reduced reach. Maybe the number of people you're supposed to cover will become minimal, and sometimes this poor budget implementation and poor release of funds can also disrupt ongoing social services. Those are the implications for poor budget implementation and release of funds. Now we're going to look at the third one, which is lack of data-driven budgets. Lack of data-driven budgets. When you don't um, draw budgets based on past records or based on current needs, there is often a disadvantage with that. And the implication is that there will be waste or duplication of allocation. If you don't prioritize based on needs of people, there is every tendency that there will be waste because you are going to prioritize the wrong area and channel enough resources to that area. And then eventually you discover that, that is not what the people actually need. That ends up being a waste. So lack of data-driven budgeting is a big challenge in budgeting. So the next one is political interference. Political interference and short-termism. The implication for political interference, that's when some welfare budgets are influenced by political interests. Maybe you say, because these people voted for me, I had more votes in this area, I will take intervention programs there. And then this area did not vote for me. I will not take any intervention program there. It's not good. That is a big challenge in budgeting. It's good to always be fair when allocating resources or when distributing these allocated resources to different areas. Government interference or political interference shouldn't come into play at all. The next is fragmentation of welfare programs. Fragmentation of welfare programs. Social welfare, where social welfare is handled by multiple agencies. For instance, you have Ministry of Women Affairs, you have NASCO, you have NAPTIP, you have so many ministries, departments or agencies that you have many MDAs handling social welfare. Most times, they all have uncoordinated budgets. We're talking earlier and we said when this fragmentation comes up, most of them will not have the capacity or the human capital or even the financial resources to be able to carry out these intervention schemes or these social welfare schemes that we're talking about. But once they come together, once there is a synergy, once there is a coordination between all of them, there will be effective delivery of social welfare. So fragmentation of welfare programs is one of the challenges in budgeting because these different fragments, these different sectors or agencies might not have the capability to single-handedly fund a particular welfare package. So that's why there's always a call for synergy. There's always a call for coordination amongst the various stakeholders so that there is an efficiency at the end of the day. The next challenge in budgeting is limited stakeholder participation. Limited stakeholder participation. We all know what happens when major stakeholders are not involved in anything, even in budgeting. The budgets fail to reflect grassroots realities, or the budget fails to reflect their specific needs because they were not properly informed or their opinion was not sought for. So eventually, maybe the aid you are bringing is not what they need. They'll just be looking at you like that. The next is capacity gaps in budget planning. Capacity gaps in budget planning. Okay. The truth of the matter is that in Nigeria, many social welfare agencies lack trained budget officers or planners people that are supposed to plan this budget, maybe they are not qualified, maybe they were employed based on man, no man, and they lack the capacity to be able to even draw out this budget um, in a way that it will be effective. That alone is a big challenge. So capacity gaps in budget planning is a major challenge. And what is the implication of this? The implication is that when they eventually submit this, their poorly structured budget proposals, it fails to attract funding, especially from the international source. When they look at it and they see that the budget that was drawn or the budget proposal is not properly done, they end up not even committing their funds again. So that is the implication of capacity gaps in budget planning. The next is corruption and mismanagement. I will just run through it. When there is corruption and mismanagement, it's a challenge in budgeting because the resources will not, or the allocated resources will not be properly accounted for. It will not be effectively put to use because a few have sat on it, or a few have embezzled it, or they have decided to, um, should I say, misappropriate them, using it in a way that they are not supposed to use, or giving it to people they are actually not supposed to give. So corruption is a big problem. The next is over reliance on external funding. Before you start up a course, sit down and count the cost. Don't just rely on external funding. Be sure that that is why planning comes into play. Be sure that in the next 10 years, we'll be able to fund this, and that. Okay, at the end of the 10 years, how do we now sustain it? Draw up plans, action plans that you are going to do to maintain sustainability. So once you just over rely on external funding and then they decide to cut the sources of those funding, like I heard recently that the USAID said they are not going to give intervention programs or release funds for free treatment of HIV and AIDS patients. You see that when if federal government decided, that's of Nigeria, decided to rely solely on the AIDS coming from USAID, it's a big problem already. So over reliance on external funding is actually a problem. And the last but not the least is macroeconomic instability. When there is inflation, um, or when there is fluctuation in oil revenue, all of this affects budgeting. Or when maybe as like they said, we are living in debt in Nigeria. We have borrowed so much that even repaying is a problem. So when we are servicing all these debts that we have collected, you see that there will be little or no resource to even allocate to this social welfare area that we're talking about. So macroeconomic instability can also cause a big challenge in budget. Having looked at that, I want to say we have come to the end of budgeting, and we're going to the last area of this discussion, which is personnel management, human resource planning. What is personnel management? Personnel management refers to the processes of recruiting, training, deploying, motivating, and managing the workforce responsible for delivering social welfare programs. So these people that are saddled with the responsibility of delivering social welfare programs, if you do not train them, if you do not recruit the right people that's during the selection process, if you not select the credible people, the qualified people, is going to be a problem. Or if you don't give adequate training, it's also going to be a problem. And if you don't motivate them in terms of their pay and other incentives, it's going to affect their efficiency. So personnel management is talking about the process of recruiting, training, deploying, motivating, and managing the workforce responsible for delivering social welfare programs. In Nigeria, the effectiveness of social welfare systems heavily depends on how well personnel at federal, state, and local levels are managed. Now we're going to human resource planning. We're going to be looking at some basic key concepts, and the first is human resource planning. Of course, they said failure to plan is planning to fail. If you want to recruit and you don't plan properly, there is already a flop there. So human resource planning is a strategic forecasting of workforce needs, including the number of people you want or and then the type of personnel that is required for a social program. So human resource planning, in the planning process, you determine what number of people to employ and in what special area, what field of people to employ, and you also determine the type of personnel you want. Is it managers? Is it people that will be on the field? Is it those in the account section? So all this comes during the planning of that's human resource planning. In Nigeria, many agencies lack adequate staffing plans, and as such, welfare programs often operate with understaffed or overburdened personnel, especially at local government levels. Like for instance, in my department where I work, we are seriously understaffed, and because we are understaffed, the few people that are there are now overburdened. Like for instance, you can imagine one person supervising 40 students at undergraduate level. There is no way that person will be efficient as a person that has been given only 5 students to supervise. So you see that there is an overburden if a particular agency is understaffed. So during the planning section, you should be able to know the number of staff needed to carry out this particular social welfare scheme effectively, and you also recruit accordingly. Or you during the planning, you state out clearly the qualifications of people you need or the criteria you want. Then the next we'll look at the recruitment and selection. After the planning, the next is recruitment and selection. This means hiring qualified personnel through fair, transparent, and competency-based processes, not just based on I know somebody that knows somebody that knows somebody that knows somebody. Most of our hiring system, that is how it is. You either get employed with your money, with your resources, you pay for it, or somebody recommended you, whether you are qualified or you are not qualified. So the recruitment and selection process should be done in a fair, transparent, and qualified based or competency based process. The impact of selecting people that are not qualified, or the impact of having a recruitment process that is not fair and transparent, is that at the end of the day, you will recruit unqualified staff, and they will not be motivated because maybe that is not their area of interest, that's not their area of passion. They are not motivated in any way. So they will just act indifferently. They will bring this I don't care attitude. And at the end of the day, that's a serious challenge. The next key concept we're going to be looking at under personnel management is training and capacity building. Training is very important. This means ongoing learning and skill development to ensure personnel can deliver high quality services. If you have employed these people, ensure you train them from time to time so that they are able to deliver um, good services, high quality services, and at the end of the day, they carry out their functions properly, and then the social welfare scheme is effectively done. The impact of um, not training your personnel or not training these social workers or those employed in the social field is that there will be low quality interventions because they are unable to deliver their job functions properly. any sound-minded person that wants to partner or wants to fund that area, we don't want to commit her resources because she has seen some loopholes already. And then if you don't train your staff or the staff that are in the social welfare area, there will be an inability to handle complex cases. In fact, when you bring certain cases to them, they'll become confused. They don't know what to do. They don't know where to start from because they were not properly trained. They were not properly guided. Their capacity have not been built to effectively handle those areas. So from time to time, it is good to always train personnel. The next key concept under personnel management is motivation and incentives. Motivation and incentives. These are strategies to encourage commitment and performance among social welfare staff, including salaries, recognition, and career advancement. When you have staff working in the social field, in the social welfare area, it is good to give them proper motivation. Let their pay be good, let their salary structure be good. This makes them to diligently carry out the work. It makes them to give it their best. And at the end of the day, they'll be very, very efficient. Most social workers are poorly paid and some lack job security. They just feel like they can sack me anytime. So they are doing things in a way that they don't really care. Or most of them receive little recognition. If you cannot pay somebody well for services done, at least recognize the person's effort so that the person knows that she has done well or he has done well. So it is always good to motivate social workers so that they can carry out their duties effectively and efficiently. The next key concept we're going to be looking at is supervision and performance management. Supervision and performance management. This involves monitoring of staff performance and providing feedback to improve outcomes. Weak supervision systems, especially in remote areas, or no clear performance indicators for many social welfare goals is going to be detrimental to the success of a social welfare package. If they are not properly supervised, if they are not, or there are no key performance indicators that at the end of this program, this should have been achieved, this should have been done. If those indicators are not put in place, and if there's no proper supervision, you will notice that the aim of the welfare package or of the social welfare scheme will be grossly inadequate or will not be duly done. The impact of lack of supervision is poor accountability for staff behavior and service delivery. And there will also be limited program impact tracking. The next is personnel management challenges. What are the challenges in the personnel management environment? The first is inadequate staffing. When you don't employ the adequate number of staff, you are going to overburden the few that are there. And once they are overburdened, once they are stressed out, inefficiency will not be there at all. They will not be efficient. That means they'll be very, very inefficient. So it is good to employ the right number of staff. That is why planning is important. During the planning process, we said earlier that from there you get to know the number of staff you need in each department and in each area. So the next challenge in personnel management is unqualified and undertrained staff. When you recruit staff that are not qualified, or when you are recruited and you don't give them good training, at the end of the day, there's a big challenge. So it is good to always employ qualified staff and also from time to time give training to those that you have already employed. Then the next challenge in personnel management is weak recruitment and selection processes. Weak recruitment and selection processes. By the time you begin to select people based on favoritism or based on tribalism or based on racism or sexism, that's gender based, you will now notice that the recruitment section is already biased, it's faulty, and as such, it's a challenge in personnel management. And next is poor motivation and low remuneration. We've talked about it before. If their pay is poor, they will not deliver their services effectively. So it is good to motivate them by increasing their pay, giving them other incentives, and even giving them recognition and giving them promotion. You hear people say, I've been working in this organization for so many years, I've not received any form of promotion. Promotion is also a way to motivate people. So it's good to always motivate social workers. The next challenge in personnel management is limited career, limited career progression and development opportunities. By the time you don't train your staff or the social workers, they will be limited in their career. That's there is no progress, there is no development. They will not be able to meet up with current trends. So it is good to always um, develop the capacity of social workers so that they can stand tall anywhere they are. The next is lack of supervision and performance monitoring. When there is no supervision, when there is no performance, social workers are left to do whatever they want to do. They don't care, they bring in their don't care attitude, and at the end of the day, the social welfare scheme is not properly managed or it's not properly delivered. It's already a big challenge. The next is can anybody hear me? Hello.
Yes, ma'am.
Okay, so we're
I hear
talking
you, ma'am.
about absence of a regulated social work profession in a situation that's how many universities do you see taking courses on social work, that they are training social workers as a course of its own? There are very few, if at all there is any. So because of this absence of a regulated social work profession, it's a big challenge of personnel management. The next is inadequate use of technology and human resource systems. They say the world is going digital. If the people you recruit are unable to use this technology, it's a big challenge because when they are confronted with situations where they are supposed to use certain devices and they were not trained in that aspect, it's a big challenge. So you need to train your staff different technologies. Who's interrupting us? The next is insufficient funding for personnel development. If enough money is not released for personnel development, there's no way they can go on training. So most organizations always like to release certain amount or set aside certain amount for training their staff so that they are current with current trends that are happening. The last but not the least area we're going to be looking at is recommendations to improve personnel management in Nigeria social welfare. What are the recommendations that can be used or that are that recommendations for improving personnel management in Nigeria. So let me correct this. Recommendations for improving personnel management in Nigeria, in Nigerian social welfare. We have a list of them. Professionalize social work with licensure and regulation. You know, before you can become a medical doctor, you have a license. Before you can become a pharmacist, you have a license. Before you can become, there are certain professions that before you can effectively carry out your work, you must be licensed. So they are trying to recommend that even social work should be licensed too. Those that have gone through the institution and have carried out work and courses or undergone programs on social work should be given license so that they will be able to operate freely. Then the next recommendation is that there should be increase in recruitment and staffing, especially at the local government level. Most people don't like to go to the rural areas, and this is actually where um, people need the social welfare. So it is always good to increase recruitment and staffing, especially at the local government area. Then the next is strengthen training on modern social protection, digital tools, and ethics. The next is improve incentives, institutionalize or area supervision and monitoring tools with key performance indicators. It's good for money. It's just like we're repeating the same thing over and over. So it's good to pass and implement the Social Work Profession Regulation Act. So with this, I should say I've come to the end of today's class. And I don't know if I'm coming back again. Maybe Dr. Abba will continue from where I have stopped. I don't know. I will speak with him, then we'll know how to go about it. But with this, we have come to the end of today's class. So I'll just take comments and questions very quickly. Hello, Mr. Dende. Are you still with us?
Yes, I'm partially with you, ma'am.
Okay, were you able to see the slides eventually?
Hello, my friend.
Were you able to finally see the slides?
Yes, ma'am. Yes, ma'am.
It's all right.
I log in again.
Okay, any comments?
No, ma. No.
All right, in the absence of any comments, so permit me to go. My attention is needed urgently. So see you some other time.
Thank you so much, ma'am, for your time.
All right, take care.
Thank you, ma'am.
All right, bye.